look at some radiological features, and this is going to be of the acute pancreatitis. So here there are some important points to note. There is the presence of a sentinel loop. So there is presence of a sentinel loop. So this is seen in an X-ray, and it is a focal area of the It is a focal area, and this is of a dynamic ileus, and this is close to the intra-abdominal inflammatory process. So this is close to intra-abdominal inflammatory process. Next, a sentinel loop is present in the upper abdomen. So sentinel loop. So the sentinel loop in the upper abdomen. So what does this indicate? Upper abdomen means that there is presence of pancreatitis. So now the sentinel loop sign. We need to know that the sentinel loop. This sign, it may aid in localizing the source of inflammation. So it helps in finding the source of inflammation. And for example, the sentinel loop in the upper abdomen may indicate pancreatitis. So in the upper quadrant, it can indicate the upper abdomen. It can indicate the presence of pancreatitis, while the one on the right lower quadrant. So in case of the right lower quadrant, it can indicate the presence of appendicitis. So upper abdomen pancreatitis, right lower it is appendicitis. Next we will look at something known as the colon cutoff sign. So in terms of the colon cutoff sign, so what does this indicate? It shows that the functional spasm. So there is a functional spasm. So functional spasm is present at the splenic flexure. It is present at the splenic flexure, and this is due to the extension of the inflammation. So it is due to the extension of the inflammation. And what is this extension of inflammation? So there is extension of inflammation to the, so it is to the phrenicocholic. It is to the phrenicocholic ligament. And what is it through? It is via the transverse mesopod. So it is via the transverse mesocolon. Then we move on to the X-ray. So the X-ray, upon X-ray, we need to look at the sentinel loop, sign, as well as a colon cutoff sign. So both this of them, it signifies the acute pancreatitis. So both of them, they signify acute pancreatitis. Then we also need to know something known as the renal halo sign. So what is meant by the renal halo? So the renal halo sign, it is nothing but the edema around the kidney. So it is nothing but edema around. So it is around the kidney. Edema around the kidney, and due to the involvement of the paranephric fat. So there is a paranephric fat which is involved. So what does it result in? It results in the obliteration of the psoas shadow. So it shows a obliteration. So it shows obliteration of the psoas shadow, as well as the localized ground glass appearance. So the localized GG appearance, ground glass appearance. So this was about the radiological findings in case of the acute pancreatitis. To learn and grow daily like this, please do subscribe.